I'm Stella, and I'm a clinical scientist working in clinical engineering.
I'm Carly, and I'm a clinical scientist working in clinical measurement, a branch of clinical engineering.
I'm responsible for the safe use of medical devices across my hospital. From defibrillators to pacemakers to hearing aids, the list is endless. My job is to ensure that all medical devices are working correctly, are safe for patients, and to investigate when they are involved in adverse incidents. I am responsible for reporting back to the manufacturers and regulators when a medical device failure results in an adverse incident. My team is also responsible for maintenance and repair of medical equipment and liaising with manufacturers if required. Another important role of clinical engineers is medical device innovation, where we design and make medical devices, ensuring they are safe to use on patients. The best thing about my job is that it impacts almost every patient because there's so many medical devices used in a hospital.
My role is to take measurements of patients to investigate whether their organs or muscles are working correctly. This can include taking measurements of pressure, resistance, or pH levels. I analyse these measurements and compare what healthy and normal measurements would look like, which helps to provide a diagnosis to the patient and any treatment that they might need. I work with a wide range of people, including patients, carers, doctors, clinical nurse specialists, ward staff, play specialists, dietitians, psychologists, physiotherapists, pharmacists, support staff, and of course, other clinical scientists. My work has a direct impact on the patients. The tests that I do are very specialised, which means people get answers and support for their complex medical conditions, which can have a huge impact on the patient's quality of life.
Something about my job that surprises people is that it exists in the first place. I often receive glazed stares when I mention the word clinical engineering. People are often surprised to realize there are people in hospitals that look after the medical devices, but we're essential to make sure that they are working correctly.
Something that's surprising about my job is that children often behave better than adults when it comes to sitting still and getting through the tests.
I often work with diverse professionals from within and outside the hospitals, such as technicians, consultants, doctors, nurses, patient safety specialists, infection control teams, facility engineers, procurement specialists or managers, manufacturers, regulators, assessors. I could go on.
There are lots of options for development in our roles. You can become a clinical academic and focus on research. You can take on a role in education and training, or you can go into clinical management roles. It really depends on the interests of each person. There's also the opportunity to work internationally, as skills in this field are in high demand globally. After A-levels, I took a year out before university to work in industry to make sure that engineering was for me. I did a degree in engineering and discovered the world of clinical engineering after hearing a lecture about it. I then went on to do the scientist training programme, and I'm now applying for the higher specialist scientific training scheme.
I trained and practiced in Nigeria for over 10 years before moving to the UK. I applied for the clinical scientist registration via the international route as my training was in Nigeria.
I love my job because it feels like I make a difference to people's lives when they receive a diagnosis and can go on to get appropriate treatment. The best parts about it is how every day is different, whether that's seeing patients, training the next generation of clinical engineers, or presenting my work at conferences. The variety means that my job is never boring.
There are lots of routes into clinical engineering, and while lots of people come through the scientist training program after university, there are many other pathways such as the practitioner training program, degree apprenticeship, and many more.
There are so many areas to work in clinical engineering. Stella and I work in 2 areas, but there are many others, including rehabilitation, medical, and radiation engineering.